My job this morning is to introduce the concept and share with you that aging has effects on the patients with hepatitis B, and also present to you the comorbid problems that we've identified as this patient's age. In fact, chronic hepatitis B, as you know, could be a lifelong infection. And in the US, there's a study that's been done to show collecting data from the commercial and Medicare database for claims submitted between the years 2006 and 2015. This slide that I'm going to show you, I hope you can all see the slide, does depict this presentation from this study. Over 40,000 patients' records were reviewed, and it does show that if you look at 2006, the mean age of the patients were about 40 to 48 years old. And by 2015, the mean age of the patients were in the 50s, suggesting that in the US, as presented by the CDC, chronic hepatitis B patients that are over the age of 55 represent the fastest growing population that we are seeing. And this will have repercussions as we go along. There are a few questions that need to be answered. And one of them is, what are the effects of comorbidities on the aging population with chronic hepatitis B compared to their younger cohorts, as well as there's an increase in risk infection. There's an increase of the risk infection in these patients compared to the younger population. We also have to consider the risk of cirrhosis and HCC as these patients continue to age. This next slide shows us what's happened when they compared the comorbidity index scores in this population between 2006 and 2015. As you can see in the gray column, the non-CHB patients, as well as the red column shows us the CHB patients. It is clear from this study, looking at the database from the commercial Medicare patients, that the DCC index, which is the Dell-Charleston comorbidity index, is almost 2 to 3 times higher in these patients as they get older. This was also shown by the Medicaid population, as the study revealed. So it is clear to us that as these patients age, their comorbidities tend to increase, and this has repercussions in terms of the management of these patients. This next slide that I'm going to present to you also shows a study of over 2,000 patients in the San Francisco Bay Area between the years of 2000 and 2015. And it is supposed to show us in 3 cohorts between the years 2000 to 2005, 2006 and 2010, and 2011 to 2015. It clearly shows that if you look at patients that did not have chronic hepatitis B, their risk of the prevalence of comorbidities in these patients were less compared to those with chronic hepatitis B. In fact, if you looked at osteoporosis and renal problems, they account for about 2 to 5 times the comorbid problems that these patients have compared to their cohorts, which were matched that did not have chronic hepatitis B. Across the board, cardiovascular disease, hypertension, hyperlipidemia also was shown to have increased in these patients as they age. And we do realize that over a period of 15 years, in an aging population, the prevalence of these comorbidities has steadily increased. The prevalence rate increased between 2 to 5 folds, with all comparisons being statistically significant. Now, if you look at this population that we studied, going back to the patients that were from the commercial and Medicare database, you would see that when you talked about cardiovascular diseases, for example, that the patients with chronic hepatitis B compared to their cohorts without chronic hepatitis B had an increase in their comorbidities as regards cardiovascular disease. Osteoporosis, again, as well as renal impairment, showed that these patients were more affected compared to controls that did not have chronic hepatitis B. Diabetes was quite significant, as I will show in the next slides, that these patients also had higher rates of diabetes compared to their controlled cohorts. So what does it mean for us? It means that at least in these patients, as they get older, those of us that are managing the patients will have to consider these comorbidities as part of our algorithm in making sure that we address these issues. And it's clear now that it's not only their hepatitis B that we'll have to treat, but we'll also have to deal with these comorbid issues. If you look at this data, this is also looking at the Medicaid population. Remember, there were over 11,000 patients that were reviewed in this group and over 30,000 in the commercial and Medicare group. The same thing is found in all these patients, that osteoporosis, renal impairment, diabetes, all were comorbid factors that were increased in these patients as they get older. So the take-home message here is that if the aging population that we have of these chronic hepatitis B patients will have these comorbidities, what do we do in terms of trying to manage this disease? And I will show you as we go along the impact of these comorbidities on the disease pattern itself. About 1 in 50 had osteoporosis, and it continues to be one of the serious comorbid factors that we find with these patients. The next slide clearly shows us in the patients that have metabolic diseases or on liver complications in chronic hepatitis B patients. In other words, if these patients were to develop complications of chronic hepatitis B, cirrhosis as well as HCC, how do these comorbid factors affect these patients? This graph looks at the patients that had diabetes, and this study comes from a database from a Taiwanese group over a 10-year period. They looked at their database from 4 centers, looking at patients with cirrhosis and patients that were newly diagnosed with diabetes. This first graph here clearly shows us that if you did not have diabetes and you had chronic hepatitis B, the chances of developing cirrhosis was less compared to those that had diabetes. In fact, it was about a twofold increase in the rate of developing cirrhosis in these patients compared to the patients that did not have diabetes. The same holds for HCC. If you looked at the number of patients that had diabetes as a comorbid factor, the graph clearly shows that it separates out compared to those that did not have diabetes. And again, it's about a twofold increase, suggesting that these comorbid factors will tend to influence the rate at which our patients develop cirrhosis and as well as hepatocellular carcinoma. So the take-home message here is that we have to clearly recognize the fact that that population with chronic hepatitis B are aging and they have increased comorbid factors that tend to affect their development of cirrhosis as well as hepatocellular carcinoma in this case. Now, this happens to be the last slide as we go along, but I would really like to point out here that these patients that developed cirrhosis were all being monitored during the 10-year period, and the graph clearly shows that there's a separation with a twofold increase, and the risk of hepatocellular carcinoma has also been something that we've seen in these patients. Thank you very much.